Good afternoon, colleagues. My name is Rassadina. I am from ITMO University in St. Petersburg. Today I will present our method for assessing the synchronization between breathing and heart activity, a joint study with ITMO University and the Genelidze Research Institute of Emergency Medicine. Cardiorespiratory synchronization is important for autonomic regulation and health. It has potential in sports medicine, neurology, and monitoring systems. However, existing methods analyze respiration and cardiac activity separately using bulky equipment. We set two key objectives. 1. Confirm stable synchronization between respiration and the cardiovascular system. 2. Show that this synchronization occurs not at breathing frequency but at a high frequency 3-5 Hz corresponding to ADA motion in the upper airways. Over many years, our team studies oscillatory processes using various sensors and methods from dynamic system theory. We developed a measurement system for ADA flow in the nasal passages, recording flow velocity, temperature, and pressure. We found an airflow structure linked to respiratory diseases. Later, we created 3D printed nasal models from CT scans and measurements matched those from live patients. Then we performed simultaneous measurements of ADA movement and heart rate. Key finding in healthy individuals high-frequency ADA pulsations 3 to 5 Hz are synchronized with the R waves of the ECG without phase shift. In patients with cardiovascular pathology, a phase shift appears. This was a breakthrough. Synchronization occurs at 3-5 Hz corresponding to AD motion in the upper airways. Now let me show the experimental result. This figure presents AD airflow movement measurements using pressure sensor and an optical carbon dioxide sensor, along with pulse spectral densities. The graph clearly shows synchronization between pressure and carbon dioxide concentration. This figure shows instrument reading. Curve 1 is the pressure sensor. Curve 2 is the NARMAX nonlinear dynamic model exponentially fitted to the data. The model accurately describes carbon dioxide and pressure synchronization during inhalation and exhalation and can be used as a digital filter for remove noise. Now look at the fast trajectories of patients. Figures for patient 1 to 4 show two distinct regions corresponding to vortex motion during inhalation and exhalation. However, this is a fast shift and the trajectories between inhalation and exhalation appears smeared. The figures for patient 5 and 6 show, in addition to the two AD regions, a third region in the center of a fast trajectory. This center region characterizes rhythm irregularity and indicates description of cardiorespiratory synchronization. In conclusion, our long-term studies established two main findings. First, stable synchronization exists between the cardiac and respiratory systems. Second, this synchronization occurs at 3 to 5 Hz, not at the breathing frequency, corresponding to the eddy airflow motion. Additional studies with the Genelides Institute confirmed that respiratory parameters closely relate to cardiovascular state. In patients with cardiac disorders, an additional third region appears in the center of fast trajectories, absent in healthy individuals. This indicates disturbed cardiorespiratory interaction. This result opened the door to non-invasive diagnostic method based on respiratory analysis. Thank you for your attention.